It seems like healthcare is going through some pretty big changes. One of the things that's caught my eye is how much more accessible it's becoming. Like, no matter where you are, there are more and more options. And I think that's what got us really intrigued about Stark Medical Chico Primary Healthcare.
Yeah, totally. What really stands out to me is their whole approach. Like they're offering virtual telehealth treatment to literally anyone living in California. That's pretty huge, right? I mean, California is a big, diverse state, and being able to reach that many people with healthcare, that could really change things.
Absolutely. They're based in Chico, California. And get this, they even do in-person appointments 1 week a month.
Oh, wow. I didn't realize that.
Yeah, but it seems like their main thing is really this telehealth model. And their mission is pretty simple, really, like making healthcare easy to access, flexible, and supportive, so people can actually get the quality care they need.
Uh,
And from what we've been reading, they're doing a lot with their virtual offerings, covering primary care, managing chronic conditions, and even helping people with addiction. The stuff you dug up really paints a full picture of how they're making it all work.
yeah, and it's really fascinating how much they can actually do remotely. Think about it. We're so used to all the hassle of going to the doctor, the drive, the waiting room, taking time off work or away from family. Stark Medical is really trying to eliminate all those barriers with telehealth so people can take care of their health without all that added stress.
You're right. It's not just about quick checkups either. They're doing routine stuff too, like annual checkups and just making sure you're staying healthy, all online. Now, I was curious about how they handle things like blood work. Yeah, so it looks like they set you up with lab orders at a place near you, and then you have a virtual follow-up to discuss the results.
Oh, that's pretty smart, actually.
Yeah, it seems super efficient, right?
It is, and it makes those preventive screenings and all the education that goes with it so much more accessible. Like they can give you personalized assessments and advice all from your own home, which can be way more comfortable for some people.
For sure. And then there's prescriptions, something a lot of us deal with. Imagine being able to manage and refill your prescriptions from home, even getting dosage adjustments and follow-ups virtually. That's got to be a game changer for anyone on medication.
Oh, absolutely. And they're even doing well-woman visits online. So things like reproductive health consultations, birth control advice, hormone support, menopause care, they've got it covered. I think that's really important because those topics can be, well, a little awkward to discuss in person for some people.
Right. It's about making people feel comfortable. And for anyone who prefers or needs to see someone face to face, Yvette Stark, their nurse practitioner, has in-person appointments in Chico 1 week a month. They even gave out the number 530-514-0904. So it's like they're trying to accommodate everyone, which is pretty cool.
Yeah, and when you think about it, this model could be really impactful for people dealing with chronic conditions, right? I mean, those often require constant monitoring and adjustments to treatment, and telehealth can make that process so much easier.
Yeah, that's a great point. And they're very specific about the support they offer. Like for depression, they have emotional support, online counseling sessions, and medication management with regular check-ins, all virtual. That ongoing connection can make a huge difference for someone struggling with their mental health.
Definitely. And for
Okay.
diabetes, think about it. Patients can track their blood sugar at home, get personalized diet advice, and have their medication adjusted all remotely. It just makes managing the condition so much more doable.
And it seems like they're taking the same approach with high blood pressure. They use remote monitoring, lifestyle coaching, and virtual medication adjustments, all without needing to constantly go to the doctor's office. So much more responsive to the patient's needs.
Yeah, they're not just treating the symptoms, they're looking at the whole person. And it's really encouraging to see their approach to obesity treatment. Their focus is on nutrition planning and exercise goals, with medication as a last resort, not the first. That's huge for creating sustainable, healthy habits.
It really is. And they're addressing menopause too, creating a supportive environment where people can openly talk about their symptoms, whether it's sleep issues, mood swings, or hormonal changes. Then they offer personalized care options, including the in-person option with Yvette Start back in Chico. It shows that they really get what people need at different stages of life.
Absolutely. And here's where it gets even more interesting. Their approach to detox and addiction counseling.
Okay, this caught my attention too. Tell me more about that.
Well, they have Dr. Brandon Stark, who's a board-certified addiction medicine specialist. And he offers confidential counseling, as well as something called medication-assisted treatment, or MAT, to help people manage cravings and withdrawal. And the fact that they offer this vital support via telehealth to anyone in California is a huge step forward in making addiction care more accessible. Because, let's be real, access is a major issue for a lot of people struggling with addiction.
Right, and they're very upfront about MAT. They clearly explain that using medications like buprenorphine along with counseling is a safe and super effective way to treat opioid use disorder.
And they make sure to outline the three main phases of MAT: induction, stabilization, and maintenance. Plus, they emphasize how important it is to work with a healthcare provider to create a treatment plan that works for you, which is really important when it comes to addiction treatment. They even mentioned the American Society of Addiction Medicine, ASAM, when talking about their MAT program, so you know they're following established best practices in addiction care.
And, the stats you shared about the opioid crisis in California, it really brings home how important this is.
Yeah, it's a serious problem. As of 2024, they estimate that 1.75% of Californians were struggling with opioid use disorder. And in just 3 years, opioid-related deaths in the state shot up by 121%. It's a public health emergency.
It's
Right. And it's not just a few organizations saying this. They list a whole bunch of reputable groups: ASAM, the CDC, NCBH, NIDA, the WHO, and tons of patient advocacy groups, all pushing for better access to MAT. It's a pretty clear consensus that this type of treatment is essential.
So, by offering telehealth to everyone in California, Stark Medical is tackling those geographic and logistical barriers that often prevent people from getting this life-saving treatment. It's like bringing treatment to the patient, regardless of where they are.
Precisely. And it's important to remember that they haven't completely abandoned in-person care. They still offer that option in Chico once a month. And they gave out the phone number again if anyone's interested: 530-514-0904. So whether someone wants to schedule an appointment or just learn more about their MAP program, they can reach out.
That's great. They're really trying to be as flexible as possible to fit people's needs and preferences.
And they're very clear about their commitment to providing compassionate and accessible care no matter what stage of life you're in. They've got this whole range of services: managing chronic diseases, preventive care, mental health support, and addiction help, all from the comfort of your own home anywhere in California. That's pretty amazing.
And just in case anyone missed it, that number again is 530-514-0904. Whether you're interested in telehealth or an in-person appointment in Chico, you can call that number. Stark Medical really does seem like a valuable partner in helping people across California live healthier lives.
So to sum it up, Stark Medical Chico Primary Healthcare is doing some really interesting things with telehealth. They're offering a wide range of primary care services focusing on accessibility and convenience. This includes routine checkups, managing various chronic conditions, and very importantly, a solid evidence-based program for opioid use disorder with MAT. And the best part is all of this is available virtually to anyone living in California, with that limited in-person option in Chico.
It really makes you think, doesn't it? Like, how could these kinds of accessible healthcare options fit into your life or the lives of people you know, especially with how difficult it can be to access traditional healthcare sometimes, or when dealing with specific health challenges? It's worth considering.
And it brings up a really important question about the future of healthcare. With telehealth becoming more and more common, how will the system adapt to meet individual needs and improve overall well-being, especially in a state as big and diverse as California? It's something to think about.
It really is. So much to consider as healthcare keeps evolving. Well, this has been another fascinating deep dive. Thanks for joining me.
Absolutely, always a pleasure.
And to all our listeners out there, stay curious and take care.
See you next time.
Bye for now.